Thank you for attending today's Medicare Transition webinar. And I'm going to go over the next page. Can we advance the page? All right. So, okay, so we're going to provide you a Medicare overview. We're going to talk about the various parts of Medicare. We will talk about ACERA and ACERA's Medicare mandate. We'll talk about Medicare and how it works, Medicare plan options, and of course, we'll be here for questions in case you have any, if we haven't answered them along the way. Okay. All right. Next screen. And here, we're going to go ahead and let Kevin, you want to go ahead and take it from here?
Yes, thank you. So just to confirm, I think we're supposed to have the video on. Says that we need to have that enabled. So the host, could you check that out, Bree? But I'll go ahead and get started too. Okay, so first let's talk about who is eligible for Medicare and who's involved. So with Medicare, basically this applies to people who are 65 years and older or under 65 and disabled. It's people with at any age with end-stage renal disease or ESRD or ALS. Who is involved in this process then? So now we know our population of individuals that may be eligible for Medicare, but how does it get administered? So that is between the Social Security Administration and the Center for Medicare and Medicaid Services, also known as CMS. So that's kind of everybody who's involved, and we'll kind of talk about the different parts, what you need to do as the individual, how Social Security is involved, how you contact them, and where the Center for Medicare and Medicaid Services fits into all of this. Okay, next slide, please. Okay, so if you are currently receiving Social Security benefits, this means that the federal government is issuing your pension check to you through Social Security, then your enrollment into Medicare Parts A and B will be automatic. So again, this is if you're already getting Social Security, but not everybody waits, or some people do wait past age 65 to get Social Security benefits. So if you're waiting past age 65, then you do need to take steps to enroll. So again, if you are already receiving your Social Security benefit, then the Medicare Part B premium will be deducted from either your Social Security check or you're going to be directly billed. So again, if you're already getting Social Security, it should be on your Social Security statement. You should be able to see it there when you turn 65. If you're not already receiving Social Security, you will get billed for it separately, and you will need to make payments to Medicare up until the time that you reach up until the time that you enroll in Social Security and start drawing those benefits, at which point it will be automatically deducted from your check. So what happens when you get enrolled in Medicare Part B? So you'll get your Medicare card in the mail. Now, if you have not already enrolled in Part B, but you are turning 65, you may have also gotten a Medicare card, and your Medicare card may say Part A only. We'll talk a little bit more about continuing to work past age 65 and deferring enrollment into Part B a little bit later in this presentation. But for now, for most people, when you turn 65, if you're already retired, then you will get your Medicare card, and Part B should be on there too. You'll see it says Medicare Part A, and it has an effective date for that. And Medicare Part B has also an effective date for that. And usually they're the same date. Okay, so one note is some retirees or dependents who are disabled may be eligible for Medicare earlier than age 65. So this is kind of what we were talking about on the prior screen. If you have a disability prior to age 65, then you may be eligible to enroll in a Medicare plan sooner, which can save you a lot of money in medical premiums. Okay. Next slide, please. Thank you. All right, so now let's talk again about what if you're not receiving Social Security. So if you're not currently receiving Social Security benefits, then you are eligible to enroll in Parts A and B at age 65. So when you're eligible at age 65, we want you to make sure that you are starting that process. You know, it's best to not rely on things to happen automatically. It's good to follow up and be proactive. And that's why when we send you invites to webinars like this, usually it's in advance of your birthday, right? So your birthday should be coming soon if you got an invite from us, or maybe you're just attending for informational purposes. But we do want you to get started on this process about 90 days before your birthday, where you contact Medicare and start the enrollment process, right? So there's Medicare's website. You can also call Social Security. So if you call Social Security, we have the phone number there. It's also on the back of your open enrollment guide. If you were retired last year during our open enrollment period, we have all of our contact information for different vendors, as well as Social Security and Medicare. And then also you can go on the website, which is the easiest way. And on the website, you can enroll in parts A and B and finish that process and get everything taken care of there. So those are the steps to take if you're not receiving the Social Security. Even if you are, it's still a good idea to follow up and do that piece just to make sure that you're on the right track. Okay, next slide, please. All right. So when you are, so this is Acera's Medicare mandate. So basically, when you turn 65 and you are retired, you do need to enroll in a Medicare plan. So there is no option to continue without Medicare enrollment if you are retired. If you are on an employer-sponsored plan, so this could be an employer-sponsored plan through working for the county, maybe you haven't retired yet, or if your spouse has an employer-sponsored plan and you're enrolled as a dependent on that plan, you may be able to defer enrollment. Again, we'll cover this a little bit more on a later slide. But for most of you that are retired and you're not on an employer-sponsored group insurance plan, you do need to enroll in Medicare. And it's important that you do it in a timely fashion because there are late enrollment penalties if you don't enroll on time. So this does apply to everybody who's receiving the medical monthly allowance. It also applies to, it also applies to all of our members who are not receiving the medical monthly allowance. So it's everybody that falls into this category, where if you're not on an employer-sponsored group plan right now, and you're member or dependent, employee or dependent, then you do need to enroll in Medicare and you need to switch to a Medicare plan. There is no other option. Okay. And currently, Acera offers one Medicare plan that's a group plan with Acera. And this is our Kaiser Permanente Senior Advantage plan. So the benefits on this plan are awesome, and we'll cover some of them as we go on through this seminar. There are other options, however. So if you do not want Kaiser Senior Advantage, you can go through via benefits and select an individual Medicare plan through them. They are a third-party exchange provider. We contract with them, and they will help you find a plan that works for you, that has a reasonable cost in your area, in your zip code, and so that you can enroll in Medicare and use those benefits. Okay, next slide, please. Okay, so Acera's Medicare mandate. So why this mandate is of value to you and Acera. So let's talk about an example. So let's say that we have a member with 17 years of service, turning age 65, and they are Medicare eligible, right? So when we say 17 years of service, we're talking about 17 years of Acera service credit. So there is something called reciprocity, where you can link retirement benefits together at different retirement systems. For this example, we're talking about 17 years specifically with Alameda County. So if you have 17 years with Alameda County, you're eligible for our MMA, which is our medical monthly allowance. And it is our second highest category of medical monthly allowance. So let's look at kind of two different group plans that we have here at Acera and compare the costs. So if you are on our Kaiser HMO plan, which is the under 65 plan, our premium rate, the total cost for the plan is $909.74. And the MMA, or the medical monthly allowance, which is the medical subsidy that we provide, covers $462.09 of that plan, leaving you as the member with an out-of-pocket cost of $447.65. So you're paying quite a bit out of pocket each month just to have the insurance. That's not including copays, prescription costs, and that sort of thing. So when you switch to the Kaiser Senior Advantage plan, when you turn 65 or when you become Medicare eligible, then your premium rate is $316.81. And the medical monthly allowance that we provide to you as the member with 17 plus years of service, you get the entire cost of your premium covered, leaving you with $0 out of pocket each month for your medical plan. You're still responsible for things like copays and prescription costs like you normally are, but there's no premium. It's completely covered by Acera. So this is an example of, some of the benefits that will come to you when you switch to a Medicare plan. And if you're in the area and you want Kaiser Senior Advantage, that's great. If not, there are other ways to get the reimbursement for the Medicare plan that you select. And we'll cover that in just a moment. Again, that's with Via Benefits, the third-party exchange provider. Next slide, please. Okay, so let's talk about what is Medicare Part A. So I'm sure some of us have seen commercials on TV, or maybe you've started getting things in the mail about the different parts of Medicare and making sure you choose the right plan. Truthfully, the things that you should pay attention to are the things that are from Medicare specifically, or from the Social Security Administration. Hopefully you can trust everything that you get from Acera as well. And the purpose of this presentation is really to help educate you about Medicare and how it works with your Acera benefits. We're definitely not trying to sell you anything, but what will happen as time goes on is you'll continue to get, ads or items in the mail that encourage you to sign up for other plans or tell you you're missing out on things. So if you ever have questions, it's a good idea to call Medicare and ask, the important questions that you may have about Medicare, because you want to make sure that you're not signing up for more things than you're supposed to. And you want to make sure that your coverage is set up exactly how you want it to be. So just wanted to preface with that. And now let's talk a little bit about what Medicare Part A is. So when you enroll in Medicare Part A, it's something that provides hospital insurance. So Part A helps pay for Medicare approved hospital stays. It helps for care in skilled nursing facilities, hospice care, home health care, blood and hospital care from qualified Medicare providers. And for Part A, you typically don't pay for it. So we're going to talk about which parts of Medicare you have to pay for. And for Part A, usually you won't have to pay for it. We'll cover it on a slide very soon that goes over when you might have to pay for Part A. But for the vast majority of people, you don't have to pay for Part A. However, you do have to pay for other parts of Medicare. So we'll cover that in just a moment. Okay, next slide, please. All right, so enrolling in Part A. So we're saying that for the most part, nobody has to pay for Part A, and here's why. So this kind of goes back to your eligibility for Social Security benefits. So I'm sure a lot of us have heard that for Social Security, you need to have worked your 40 quarters, right, to get the Social Security benefits. So Social Security defines that as 40 quarters of substantial income. And if you have that, which most of us do, that are retirement age, then you are going to get the Medicare Part A for free. Now, if you have less than 40 quarters, that's when you might start having to pay for Medicare Part A, okay? So if you have between 30 to 39 quarters, it's $274 a month for Part A. If you have 0 quarters, it's up to $506 a month for Medicare Part A. So in 2023, these are the costs. It does change year to year. Sometimes it stays the same, but it can change year to year, and it's up to Medicare to decide how much that amount is that you may pay for Part A. But historically, if you have 40 plus quarters, Medicare Part A is free because you have been paying into it, or you paid into it while you were working. All right. And if Social Security says that you need to pay for Part A, contact Acera and contact Medicare just to make sure that you have that information correct. Okay. if you choose to buy Part A, so let's say, for instance, you don't have 40 plus quarters. If you choose to buy Part A, you must also have Part B and pay the monthly premiums for both of them in most cases. So you want to make sure that you're not just buying one part of Medicare, because if you do, then your insurance coverage isn't going to work out, and you're going to have penalties for late enrollment possibly. So this is the Part A late enrollment penalty. So you can possibly have to pay higher premiums for twice the number of years you could have had Part A but did not sign up. So if you have more questions on the penalties that come for not signing up for Part A, it's a really good idea to go on Medicare's website. They have a whole page on enrolling in Part A and what those penalties might be if you don't sign up how you're supposed to. Okay, next slide, please. All right. So for Medicare Part B, so Medicare Part B is one of the types of costs. Actually, it is the type of cost with Medicare that everybody has to pay for. So if you are enrolled in Medicare, which you will have to be eventually, the Medicare Part B cost is there, and it scales based on income. So what is Medicare Part B? It helps pay for Medicare approved doctor services, outpatient care, preventative care services, diagnostic tests, and some other services that supplies that Medicare Part A does not cover. So you can kind of see based on the last slide and this one that the combination of those two things together kind of helps put together a comprehensive health plan for you, right? That's going to cover just about everything, right? The only thing that we're not seeing on here is prescriptions, and we'll see that in just a moment and explain how that fits into things. Okay. So for most Medicare eligible individuals, last year in 2022, the Medicare Part B premium, the amount that you absolutely have to pay, it's the minimum, was $170.10. And in 2023, the base premium for Medicare Part B was $164.90, or is $164.90. So actually it went down a little bit this year for the cost for Medicare Part B. Again, that is the minimum amount that somebody would be paying for Medicare Part B. Anybody that's enrolled in Medicare must be paying at least that amount per month for Medicare plans. Okay, and this premium is usually deducted from the Social Security check unless you don't have Social Security or you haven't started collecting it yet, in which case, going back to what I talked about earlier, you would be billed for that. And that's something that you have to work out with Medicare, how you're going to pay them the amount that you owe them for those Medicare premiums if you don't have Social Security. If you do, it's going to come out of your check. So, if you need to know if a test or an item or a service is covered under Medicare, you can go to medicare.gov and take a look at what Medicare covers. And there's a whole page on this, and you can enter and search. So you kind of saw our list of different items that apply, and some of it says, some tests apply or some of this applies. If you need a more comprehensive list, you can go on Medicare's website and search, and there's a lot of detailed information on what services are covered and what is considered maybe like an elective procedure or something like that. Okay, next slide, please. All right, so enrolling in Medicare Parts A and B. So if you need to get enrolled in Medicare Parts A and B, again, if you're already enrolled in Social Security and you're getting your Social Security payments, it should happen automatically, but it's a really good idea to contact Medicare and double check that your enrollment is happening as you expect it should. They'll also be able to tell you when you can expect your Medicare card in the mail, which will be an important step for another thing that Acera offers, which we'll talk about in just a moment. If you're not already receiving the Social Security, again, you have to contact Social Security to enroll in this. So it's a good idea either way, if you're getting your Social Security check or not, to contact Social Security and make sure that process is initiated. The phone numbers for Social Security is there. You can also go online. You can visit your local Social Security office. Just keep in mind, if you call or if you go into a local Social Security office, it could take some time. You may end up waiting. Online is certainly the fastest method. There's also a lot of other information there for you when you go on their website. So you fill out the application for enrollment for Medicare Part B, and then you get it back to Medicare. You get it to Social Security. They work hand in hand. Social Security is basically the greater organization, and then Medicare is a subpart of Social Security. That's the way to think about it. Okay. So when you send it into Medicare, this is an important note, it does not guarantee that you're now automatically enrolled in Part B. They have to make sure that you're eligible to enroll. They have to make sure that everything with your application is completed correctly in order for your Part B to go through. So it's a really good idea to follow up on this. If you haven't heard back or you haven't gotten your Medicare card, you want to follow up with Social Security or with Medicare to make sure that your information was processed successfully and you're on track to get enrolled, so you don't have to face any late enrollment penalties or anything like that. Okay, next slide, please. Okay, so enrolling at the right time is critical. So on the earlier slide, we had talked about trying to get this process started 90 days before you become Medicare eligible. And for most people, that's age 65. So there's what's considered to be a 7-month enrollment period. So it starts 3 months before the month of your 65th birthday. And your effective date for Medicare is the first of the day in the month at which you become 65 for most people. So then the entire birth month is also a valid period. If you're enrolling during your birth month, you're a little bit behind the ball, but that's okay. You're not going to face any lifetime enrollment penalties, and you can start that enrollment process with them and get it going. You also have 2 to 3 months after the 65th birthday. We really don't want you to wait until this point because you may lose out on other benefits that we'll talk about in just a moment with Acera, at least for a month. And you want to make sure that you get this done as soon as you can when you know that this is coming up and you know that you need to switch to a Medicare plan. Okay, so this is the time frame. So 3 months before your 65th birthday, the month of your 65th birthday, and then 2 to 3 months after your 65th birthday. There are some exceptions to this. Again, kind of going back to what I had mentioned previously about the employer-sponsored group plan. If you're on an employer-sponsored group plan, either as the employee or as a dependent, there's some exceptions to this rule. Again, we'll cover that in just a little bit more in a moment here, but I want to at least highlight that there is one exception there. Okay, so what happens if you miss the initial period? What if you miss that 7-month window and you were supposed to have enrolled in Medicare? So you can enroll in January through March of each year, and then the coverage will become effective July 1st of that same year. And here is the really awful part. There's a lifetime 10% penalty for each 12-month period that you didn't enroll in Part B. So that is a lot of money that you lose out on. When we say lifetime, it's throughout your lifetime. You can never make that penalty go away if you late enroll into Medicare. And again, this is the exception here. So working aged. So if you are covered under an active working spouses plan, or if you're actively working and on an employer-sponsored group plan, then you can defer enrollment into Medicare. But the really important part is, as soon as you lose coverage on that plan, either by leaving employment and losing coverage that way, or your spouse leaves employment, or you get dropped from that plan for some reason, then in that case, you need to enroll in Part B and start that process immediately. Because if you wait beyond that, then again, you're facing these lifetime penalties and that's something you really don't want. Okay. And then there also is a Part A penalty that we were talking about a little bit before too. If you did not work the 40 quarters for Social Security, then you would also be subject to a late enrollment penalty for Part A late enrollment as well. So it can stack up severely if you wait to do this. So it is a really important step to make sure that you follow through and get everything squared away. It's the last time you have to worry about it too.
Hey, Kev?
Yes.
Yeah, just real quick. So there was a comment, someone was saying that the audio is supposed to be cutting in and out. So just maybe check your,
Oh,
I mean,
okay.
I hear you fine, but just check your connection, make sure everything is in correctly.
Okay.
And then another question that came up was, I will not be on SS, so Social Security. Do I have to pay out of pocket for Part B? If so, how do I get reimbursed by Sarah? I believe you're going to be coming up into that pretty soon, right?
Yes. Can you hear? You said you can hear me. Okay, right?
I can
Everything
hear you.
sounds clear.
Yeah, it
Okay.
sounds like someone had made a comment that it sounds like you were cutting in and out.
Oh,
So
that is
maybe
unfortunate.
slow it down just a little bit. Maybe the microphone's not catching everything.
Okay, we can do that. No problem.
Mhm.
And just to confirm, this whole video is recorded too, and it will be posted on our website. So if you did miss something I said, we will have it posted on the website as well. Usually it takes about a week to get it on the website. Okay, so let's move on from this. If you could take me to the next slide, please. Okay, so if you're on the employer plan, you're actively working. So this is the options that we were talking about. You can delay your Part B enrollment because you are enrolled on a valid employer-sponsored group plan. And typically to be on an employer-sponsored group plan, you have to be working full-time. Usually that is the rule, or very close to full-time. You can enroll in Part A and B while you're working, and on that employer-sponsored group plan, you actually have the option to do that, or you can defer the enrollment and enroll later when you stop working on that employer-sponsored group plan. The other option that you have is you don't have to take your employer-sponsored coverage or your spouse's employer-sponsored coverage. You can go separately and say, and waive that coverage, and then enroll in Medicare, when you turn 65, and now you can enroll in Medicare plans and get access to those lower premiums and really good coverage. Next slide, please. Okay. So for the Medicare Part B monthly premium for 2023, so this chart is from Medicare's website, and it will explain what you would be paying out of pocket, right? Because when we said for Medicare Part B, the premiums that you would be paying, there is a minimum amount that everyone has to pay. And then depending on your income, it scales up the amount that you have to pay for Medicare Part B specifically. So you can look at this chart or this table and see how much you would have to pay for Medicare Part B. They are looking at your annual income from 2 years ago. So it's saying yearly income in 2021 is what you will pay in 2023. So in 2021, we can see that first category. If you're filing an individual tax return and your income was $97,000 or less, all the way over to the right is the amount that you would have to pay for Medicare Part B. If your income is between $97,000 and $123,000, then your monthly amount for Medicare Part B would be $230.80 and so forth. So you can see how if your income is higher, then you have to pay more for Medicare Part B. That's just the way that it is. There is no way around that, unfortunately. If your annual income was really high for a specific year, maybe due to inheritance, or you sold a bunch of investments or something like that, then it would be important to contact Medicare and see if there is a way to adjust the amount that you're paying for Medicare. And in the next year, they will be looking at your income. And if it is different for the next year, then they will work with you to reduce the amount that you're paying out of pocket for Medicare Part B. Okay, next slide, please. All right, so I had mentioned this a little bit before about benefits you may miss out on if you late enroll in Medicare with Acera, and this is specifically what I was talking about. So Acera offers a Medicare Part B reimbursement plan. So we will reimburse Acera retirees with 10 or more years of Acera service credit the minimum amount that somebody would pay for Medicare Part B. So on the previous slide, we had looked at what that minimum amount was, and the Board of Retirement voted to approve that as the amount that we would reimburse, which typically happens every year. and the monthly reimbursement amount is $164.90. So if you are in that lowest income category that we saw on the last slide, then your full Medicare Part B premium would be reimbursed to you via your Acera retirement check. So we pay that non-taxable subsidy to you, the Medicare Part B reimbursement to you on your Acera check. However, in order to qualify for this, again, you have to have 10 plus years of Acera service credit. You have to be the member, or you can have a service-connected disability retirement with any amount of service credit from Acera or from other systems, but you have to be service-connected disability retired from Acera in order to be eligible for this. In addition to this, you also have to provide proof of enrollment in Medicare Part B and proof to Acera, and this would be in the form of a copy of your Medicare card that shows your Medicare Part A and Part B effective dates. And you have to remain enrolled in Medicare Part B to be eligible for this. So some really important notes here. This is not a retroactive benefit. So as a part of your Medicare enrollment with Social Security, you also want to make sure that you separately apply for and submit all the required documentation to get enrolled in this with Acera, assuming you're eligible for it. So the sooner you do that, the more likely we are to start it as soon as possible, right? In the month that you turn 65 or in the month that you become Medicare eligible. And then you can continue to get that for the rest of your life as long as this non-vested subsidy exists. So it's not an automatic enrollment. We were talking about if you're already receiving Social Security, they might start deducting Part B automatically and enroll you in Part A automatically too. And then that part is happening automatically. So this part with Acera, there are 2 steps to complete this, right? So you have to complete our Medicare Part B application, which is a form that should have been included in the packet that was mailed to you. If you need a copy of the form, it is available on our website. So if you go to www.acera.org, you can go to our forms page, and then from there, it's the Medicare Part B reimbursement application. And then from there, you complete the form and send it to us with a copy of your Medicare card showing your Part A and Part B effective date. Once we have those 2 elements together, then we can enroll you in that benefit, assuming you've met the eligibility requirements, which we have the bullets for here on our page right here. Okay, if you are wanting to enroll in the Medicare Part B reimbursement plan, you do not have to enroll in our Acera Kaiser Senior Advantage plan, our group plan. You can enroll in a VIA benefits plan, or you could be enrolled in another Medicare plan elsewhere. That part is not required. So the important things, again, is the application form and the copy of your Medicare card. And when we get those is the time that we can process it. If you submit that late, like let's say a few months after you turn 65 and after you've been enrolled in Medicare, we're not going to go back and give you credits for the months that you missed. If you wait a couple of years to submit this to us, we won't go back and give you credits for the prior years that you missed out on. It is made effective in the next month that we can process it, and no sooner than your Medicare Part B effective date. Okay, next slide, thank you. Okay, so Part D premiums by income. So we'll kind of talk a little bit more about Part D soon, but what Part D is basically the part of Medicare that covers prescription drugs. So in the previous slides, we talked about what is Part A and all of those things that it covers, what is Part B and all of those things that it covers. Part D is specific to prescription drugs. So depending on your income level, you may also have to pay an additional amount to Medicare for Medicare Part D. And this, if you're already enrolled in Social Security, will be deducted from your Social Security check, just like Medicare Part B is. And if you are not already enrolled in Medicare Part B, or sorry, if you're not already enrolled in Social Security, and Medicare is billing you for Part B, they may also be billing you for Part D based on that income from 2021, from 2 years ago. So this is an additional amount that you are required to pay in order to be enrolled on a Medicare plan and order to be enrolled in Medicare in general. So again, you can see if $97,000 or less is your individual income rate, then your plan premium is the only amount that you have to pay, which would be your Medicare Part B cost plus, whatever the premium is for that plan. So if you're making, or 2 years ago, if you made additional, amount, let's say $97,000 up to $123,000, then there's a $12.20 monthly cost for Medicare Part D, an additional amount that you have to pay for Medicare Part D on top of the amount that you're paying for Medicare Part B and whatever your medical plan premium is. Okay, so that's a little bit about how Medicare Part D works, which is an additional part of Medicare that helps group everything together from hospital insurance to doctor care to prescriptions, right? Okay, next slide, please. Okay, so let's talk about the types of Medicare plans. So, and actually on this slide, it should say in that kind of brown colored box, it should say Medicare Advantage plan, because there's the two types of plans, right? So on the right side, we have the Medigap and supplemental plan. And on the left side, these are Medicare Advantage plans. So when we're talking about a Medicare Advantage plan, Acera's Kaiser Senior Advantage plan that we host, our group plan, is a Medicare Advantage plan. So that is an example of a Medicare Advantage plan. So with a Medicare Advantage plan, it's assigned to a selected carrier medical group. In that case, it would, in our case, it would be Kaiser, right? When you have a Medicare Advantage plan, you select a primary medical doctor. You have to get a referral from your primary doctor to see a specialist. Almost all of the Medicare Advantage plans that are out there also include a prescription Part D plan as a part of a whole package deal. So you don't have to go out and purchase a separate prescription drug plan for Part D, and we'll talk about that in just a moment. Your copays can vary depending on the Medicare Advantage group plan that you select. For reference, our Kaiser Senior Advantage plan has a $10 copay. And you have to reside in the plan's service area. So for our group plan for Kaiser, you need to live in Northern or Southern California, and you have to live within a certain zip code range. You can always call the plan provider and confirm what the zip code range is. So if you're thinking about moving and you want to make sure that you don't lose coverage, you can always call the medical provider and confirm what your zip code is that you're moving to before you actually move, so that if you are really serious about keeping that same coverage, maybe you'll reconsider moving, right? So it's always a good idea to be proactive about that and double check. And if you do move and lose your coverage because your zip code is now in a different area, it's not within the service area, then you will be required to switch on to a different plan. And there are solutions for that. We have via benefits in order for you to be able to do that. So okay, so that's Medicare Advantage plans on the left side of this screen right here. Oh, and there we go. Okay, it looks like my video is working now. All right, thank you for enabling that. Okay, so Medigap and supplemental plans, right? So Medicare is not assigned to a selected medical carrier group or medical group, right? So if you select a Medigap or supplemental plan, you don't have a primary doctor. However, there are some benefits to this because you can go see any medical doctor that accepts Medicare nationwide. So you don't need a referral to see a specialist, and you can see any specialist nationwide that accepts Medicare. So it's medical only. So if you choose a Medigap plan, then you do need to purchase a separate prescription drug plan. And there's lots of different options out there for the Medicare, for the prescription drug plans. So definitely, this is a little bit more complicated, I would say, just because you have to do kind of two parts to it. But it can work out better for a lot of people in some cases. Now, your copays and deductibles may vary depending on the plan that you select. And the United States is the service area for these plans. So if you ever move internationally, Medicare is not going to cover you for regular routine health services. If you're traveling internationally and you have an emergency, most plans have something in place for something like that. Okay, so there's some benefits to each one for Medicare Advantage plans or for Medigap and supplemental plans. And it's ultimately up to you to decide, what's going to be best for you. Next slide, please. Okay, so let's talk about Sarah's group plans and what you need to know for switching when you turn 65 or when you become Medicare eligible, right? So our sponsored group plans when you're under 65 is our Kaiser Permanente HMO plan, which some of you may be enrolled in. And then some of you may also be enrolled in our United Healthcare Signature Value HMO plan and United Healthcare Signature Value Advantage HMO plan. So it's two different types of the United Healthcare plans that we offer. So all three of those plans are not available to you anymore when you switch to Medicare, and you have to switch to Medicare, right? We covered this as a mandate, right? So when you switch from those plans, your options when you switch to Medicare are the Kaiser Permanente Senior Advantage plan. Also, you can switch to Via Benefits. Via Benefits, the third-party exchange provider that will help you select a plan. So maybe you had United Healthcare before when you first retired or up until now, and you're like, well, I really wish I could keep United Healthcare because I like them a lot. If you go through Via Benefits, more than likely in your zip code, if you were eligible to be enrolled on United Healthcare before, you will be able to select a United Healthcare Medicare plan and continue, and possibly, continue seeing the same doctor and everything too, right? So talk to Via Benefits, see what they offer and see what plans you can select, and then you can enroll in those plans. It's not going to be the same coverage, right? Because our group plans offer what we have negotiated for as time has gone on previously. But when you switch, you can still get that same United Healthcare coverage. It just might be a different level of coverage, right? You might not have all of the same awesome benefits that you get under our group plans that we've negotiated for currently, right? So it's really important when you're on the left side here, these yellow categories, right? These are items that are not available to you when you become Medicare eligible and turn 65, right? When after 65 and you're Medicare eligible, then you have to switch either to Kaiser Senior Advantage or to another Medicare plan. You have to go find one if you don't want the Kaiser Senior Advantage plan, right? And Via Benefits will help you with that. Okay. All right, so what are some of the benefits of the Kaiser Permanente Senior Advantage plan? So this is, again, a Medicare assignment or a risk plan or a Medicare Advantage plan. Two ways to kind of talk about the same thing. If you are enrolled in our Kaiser Senior Advantage plan, you have to be enrolled in Part A and Part B. There is a specific type of plan that you can enroll in, which may not be available forever, but if you defer enrollment into Part A, you can apply for a Part B only plan with us, specifically for our Kaiser Senior Advantage plan. But there's some things to be aware of. If you sign up for something like that, then you may end up, it may not be a thing forever, first of all. And then if it's not a thing forever, then you may have late enrollment penalties for Part A. So it's very restrictive if you follow that plan. It's generally a good idea to pay for Part A and get enrolled in that and pay for it in order to have your coverage and give you the flexibility to be able to move coverage somewhere else without lifetime penalties, right? Okay, so are there any questions?
Yes, we have some questions, Kev.
Okay.
Okay, so we have someone who's asking, what would happen if I enroll on the MBRP plan and a Sarah deduct the payment the following year? I receive this deduct the payment, and the following year I receive an inheritance, which it will increase my increase fee for that year.
Mm-hmm.
How will it cover Sarah cover this increase?
Okay,
and there's multiple. It said, and will Sarah drop me off from making the auto deduction from my pension?
Good questions. So the amount that Acera reimburses for Medicare Part B is flat across the board. So there's some of our retirees who have really high incomes and some of our retirees who have, more normal incomes. And depending on, it doesn't matter based on the income, we will reimburse the same amount for Medicare Part B regardless. So if your income changes vastly from one year to the next because you got an inheritance, then your Medicare Part B amount that you're paying will continue to be the same amount that everybody else is receiving. So $164.90 is the rate for 2023. The important thing for you as the individual is you have to remain enrolled in Part B. So let's say, for instance, you weren't enrolled in Social Security before you turned 65, and now Medicare is billing you. Well, if you don't pay the bill to Medicare, you can get dropped from Part B. And if you get dropped from Part B, you lose your eligibility for our Medicare Part B reimbursement plan. This doesn't happen very often. Typically people are very good about making the payments to Medicare if they need to, or it's already deducted from your Social Security check and you don't need to worry about it. But it is important to know that just because you got enrolled at some point doesn't guarantee that you're going to be enrolled forever. It's also what's called a non-vested benefit, which means it's not guaranteed. There has to be funds in our supplemental reserve in order for us to continue offering non-vested benefits like health subsidies and Medicare Part B reimbursement. Everything's looking really good for that. Our future is looking bright. The pension fund is very strong. So we'll probably be able to offer these, for a very, very long time and not be something you have to worry about losing. But it is important to note that, it is not a guaranteed benefit and you will continue to receive it as long as you, follow the eligibility rules. You don't need to worry about, the changes in income. And what was the second part to the question? I just want to make sure I answered everything.
It's this increase. Will Acera drop me from making the auto deduction for my pension?
Nope, you won't get dropped. So the important thing is if you are enrolled in our plans, you can continue enrollment. It will happen each year as long as you don't switch your coverage. And same thing with the Medicare Part B reimbursement. If you retain your enrollment in Medicare Part B, you don't have to worry about losing that benefit. You will continue to be enrolled. You don't have to re-enroll every year, or anything like that. You just have to make sure that you remain eligible for Part B.
And just to help clarify, so you're at a level where Medicare is charging you 164 for the Part B. Acera is going to be reimbursing the base amount, which is 164. If for whatever reason Medicare Inc. starts to charge you higher than what the base amount is, which is the 164, Acera will still continue to only reimburse the base amount, which is that 164. Okay, so Medicare, they do an annual review. And so if they see that your income has increased, they may, and it pushes you into the next category where they have to charge you an extra amount above the 164, then Medicare will do whatever it is that they adjust according to their sliding scale. But Acera will still continue to only reimburse the approved amount, which is the base amount. Okay, just the FYI on that. Another question that came up here is there an FAQ document or other tool that provides info on Medicare approved elective procedures?
Yes, that is available on Medicare's website. So if you go to medicare.gov, they have tons of information. There's all sorts of links. Probably the best place to start would be getting started with Medicare. And then once you get started with Medicare, there are links on those pages to take you to other places to answer more questions. And there's frequently asked questions all over the place on Medicare's website.
Yes, Medicare does have that book. It's called Medicare and You, and it'll state the current year. That's a very informative book. It has a lot of information on it that you can simply go through. That also has a good index that you can help find things. And you can either normally they send you a hard copy of that. I'm not sure if they're still doing that, but you can order a hard copy mailed to you, or you can always download the PDF of that from their website, and that way you can review it that way. Okay. Another question we have is on the current slide. It shows 316.81 plus the 164. How do I pay for this?
Okay, so on one of the previous slides, we saw the $316.81 amount, which you can actually see here on this slide as well. This refers to the current amount or the current premium that somebody would have to pay for the Kaiser Senior Advantage plan. And as we saw on the previous slide that we were looking at that had this amount, if you have enough years of service credit, then this full premium amount will be subsidized. It'll be paid for completely. So with the $316.81, this is actually deducted from your ACERA check if you choose to enroll in our Kaiser Senior Advantage plan, right? This would be deducted from your check, and then at the same time, ACERA would be adding a subsidy to your check. So you would see on your statement, your pay statement from ACERA, there's a deduction for the cost of the plan, and then there is a subsidy section that would reimburse you for the full cost of the plan. So that is a $316.81. And then the other part of the question was the $164.90. So that is the Medicare Part B amount. That is the subsidy. It's also the minimum amount for Medicare Part B. So if you are getting charged $164.90, that's going to be deducted from your check from Social Security, either that or you're billed for it, right? This is all dependent on whether you're enrolled and receiving Social Security. Now, if you are enrolled in Social Security and you get Part B, then that $164.90 is deducted from your Social Security check, right? If you have not enrolled in Social Security or you're not receiving a Social Security check, then you have to pay the bill to Medicare in order to get the coverage for Medicare Part B. So the other $164.90, just to not make this too confusing, is that Medicare Part B reimbursement amount for 2023. So how does ACERA reimburse you for the Medicare Part B reimbursement amount? There is another category on your pay statement where you will see that Medicare Part B reimbursement adjustment amount. It's a non-taxable subsidy that goes onto your pay statement. It goes onto your ACERA check, and we give you that amount each month. So just to kind of summarize this, you pay Medicare Part B, they deduct it for $164.90 for Part B, and then we reimburse the $164.90 on your ACERA check. So it's kind of split up in that sense. Again, if your income is higher, right, you may be paying more for Medicare Part B, so you won't see those numbers match up, right? It'll look like we're reimbursing you for a lower amount than you're being charged, and that is correct. And the reason for that is because we pay everybody the same Medicare Part B reimbursement amount. And this year it is $164.90.
One more question we have, Kev, is Medigap the third-party plan? I'm confused.
Okay, so the third-party plans, when we're talking about our third-party exchange provider via benefits, they will help you shop on a market to select a plan. And on that market that Via Benefits offers, Via Benefits is just the intermediary to help you get a plan selected. When you go through Via Benefits to select a plan, you'll have your choice. You can choose Medicare Advantage plans, or you can choose Medigap plans, right? You'll have a selection to be able to select both. And then it's up to you to decide, do I like the Medicare Advantage plan? Maybe there is a lower premium, but I have to pay a lot of copays, or maybe I want to go with the Medigap plan and have that flexibility where I can get coverage, anywhere in the country. And now I'm paying a higher premium for something like that. So when you go through Via Benefits to select a plan, you'll be able to choose between Medicare Advantage plans or Medigap plans. And also you'll be able to purchase the supplemental drug plans there too. Hopefully that helps clarify. Okay.
That's it. Okay.
Actually, can we go back to that slide? I think I didn't quite cover everything on the Kaiser Senior Advantage. Okay. So let's talk about the cost. So previously, when we talked about the $316.81 for the Kaiser Senior Advantage plans, that's for you as the individual getting coverage on this plan. So if you have dependents, right? So if you have a spouse or another eligible dependent who is Medicare eligible, then your total cost for that plan is $633.62. Now, if you have an eligible dependent, like let's say a spouse or a child that's eligible to be on the plan, and they are under 65, or in other words, not Medicare eligible, then your out-of-pocket cost is $1,226.55 per month, because it is the $316.81 that you pay as the retiree to have the Medicare portion of it, and then the 900 some odd dollars for the dependents enrollment on the plan as well. So just because you are Medicare enrolled doesn't mean that your dependent is Medicare enrolled. And the way that this works actually is the coverage is split up too. So the Kaiser Permanente Senior Advantage coverage is what you would have access to. So about, $10 copays and prescription costs. Whereas your dependent, if they're enrolled on our Kaiser HMO plan now, they may be seeing the $15 copays and prescription costs. And the coverage is just slightly different between the two. And the important thing to note is that the premium will still be considering the difference in those two things. One part of the premium is Medicare, one part of the premium is non-Medicare. Right. And so we also have some examples here too, the family plan. So if you have a family plan where you have two individuals with Medicare and one without, then you will have this cost, the $1,388.74. And if you're the only one with Medicare and the rest of your family is non-Medicare on this plan, that is the total cost there, $1,981.67 per month. Okay. So the benefits of the Kaiser Senior Advantage Plan when you're enrolled in that is you've got $10 copays for office visits, allergy treatments, hearing and vision exams, immunizations, and prescriptions, of course, too, right? Also, one of the extra benefits that we have for the Kaiser Senior Advantage Plan is the Silver and Fit Gym membership, which we have a slide for, and you'll see it in just a second. And we have that for plan year 2023, and we hope to keep it going forward. But that part isn't guaranteed to be on the plan always. It's based on utilization. So the more people that use it, the more likely we are to keep it on our plan. Okay. So again, this last part here is a reminder that if you are enrolling onto the Kaiser Senior Advantage Plan, you should be enrolled in Medicare Parts A and B, and you have to be in order to come onto the plan. And again, we do have that Part B only plan available currently if it applies to you where you have not purchased Part A. Again, just be cautious of that, because if you ever decide to switch to another plan elsewhere, there really aren't, Part B only plans out there. There's very few, and not guaranteed that you'd be able to get access to them. So it's important to note that if you have to pay for Part A, or Medicare is telling you that you have to pay for Part A, and you decide to not enroll in Part A and only choose our Part B Kaiser Senior Advantage Plan, you could end up kind of stuck with this plan and end up having to pay a late enrollment penalty later if you decide to move or if the plan isn't available to you for some reason. Okay, so just a good warning there. Next slide, please.
And then there's two questions, Kevin.
Okay.
So one question is, if I have Kaiser is 160, if I have Kaiser, is the 164.90 Medicare separate from the 316.81?
Good question. So the 164.90 is separate from the 316.81. So the way to think about this is you have two premiums that you have to pay, right? You're paying the 316.81 premium to have the Kaiser coverage. That's one premium. The other premium is separate, and it's a premium payment to Medicare just to have Medicare at all. Okay. And the 164.90 is your payment to Medicare. So that's going to be deducted from your Social Security check, right? And that is your payment to Medicare just to have Part B in the first place. The other part of it is the 316.81. That's your premium to Kaiser. And that's the amount that's deducted from your ACERA check to pay for the Kaiser coverage, which, depending on your ACERA service credit, may be fully subsidized, right?
And just to clear it, if by chance you are not collecting a Social Security check because you're waiting for your age to be higher to get a larger benefit, then Medicare will send you a bill quarterly. They'll bill you for 3 months of the 164.90 or whatever the premium is that they're going to charge you. But on your SARA statement, you'll be receiving the 164.90 monthly. Okay, so it's only if you're collecting a Social Security check that they'll deduct it automatically. But if you're not collecting a Social Security check, they will bill you quarterly for the Medicare premiums. The next question was, just to clarify, not on Social Security. SARA basically pays both base rate for Part B and for Senior Advantage, just in different ways. Is this correct?
Okay, so if you're not on Social Security and your question is if SARA is paying the base rate for Part B and for Senior Advantage, the way to think about this is if you're not getting Social Security, right? So if you have less than 40 quarters and you're not getting that Social Security benefit, then you may get reimbursed for Part B through our SARA Medicare Part B reimbursement program. You have to be eligible for it. So you have to have the service credit, you have to submit the application, you have to enroll in Medicare Part B with a copy of your Medicare card, right? We have to get all those elements in order for you to be enrolled in that. If you do complete that enrollment process, then we do give you that reimbursement for $164.90. And if you also are eligible for our maximum subsidies, which help cover the cost of the Kaiser Senior Advantage plan, then you will also receive a subsidy for that. So depending on your income level, if you enroll on our Kaiser Senior Advantage plan, you may be paying nothing out of pocket for Medicare Part B, or at least it seems that way because it's all getting reimbursed to you. You may also be paying nothing out of pocket for the premium for your Kaiser Senior Advantage plan. So again, it scales based on those tables we saw for Medicare Part B and Medicare Part D. If your income level from 2 years ago was higher, then what we subsidize, what we pay for Medicare Part B may not cover all of what you owe Medicare in order to be enrolled in Medicare. If your income level falls into that lower category, then you will see that we are subsidizing and reimbursing you for the full cost of what you owe to Medicare each month, which is a great deal. And then the premium is subsidized as well, depending on your service credit, right? We have different service credit categories. It's individuals with 10 to 15 years of service get a certain MMA, and then from 15 to 20, there's a second category of MMA, and then from 20 plus years of service, a third and maximum category for medical monthly allowance. And if you have over 15 years of service, then you are getting that maximum medical monthly allowance for the Kaiser Senior Advantage plan at least, and your full subsidy would be applied, and you would not be paying anything out of pocket for the Kaiser Senior Advantage premium.
Last question that's here on the board. It says, is Medicare Part A enrollment needs to be renewed?
So your Medicare Part A enrollment should stay. If you start Medicare Part A enrollment when you turn 65, then everything should continue going forward. The only reason that you would need to renew Medicare Part A is if you got billed for Medicare. Let's say you're not getting Social Security and you got billed for Medicare, but you didn't pay them, then they will drop your coverage, right? And you need to contact them to get retroactively instated and do it quickly. Now, if you are enrolled in Medicare Part A and maybe you worked 40 quarters for with Social Security, and you are receiving a Social Security check, or you will be eligible for one, then Medicare Part A is free. There's no reason that you would lose Medicare Part A. The only reason you would lose Medicare Part B is if Medicare bills you separately outside of your Social Security check, right? If you're not receiving it yet and you don't pay them, then you get dropped, and that's a problem, right?
Thank you.
Okay. I think we're ready to continue. So let's talk about, we're still on the Kaiser subject. So let's talk a little bit about the Silver and Fit. So this is that program that we started, I believe it was 2 years ago. Is that right? It was started in 2021 that we started this?
Yes, so we had it as a trial run. Kaiser allowed us to go ahead and try it out for our members to see how they like it. And then we were able to go ahead and add it in the following year.
Yep. And we've been having this, program for the last 3 years now, so or including this year. And basically, what this is you get access to a free gym membership, depending on the gym. And so, not all gyms are part of this. And if there is a gym that you're interested in having be a part of this, and you find out that it's not, you can contact them and request that it be included. But there are a lot of gyms all over Northern and Southern California that are part of this membership to you. And if you want to get enrolled in this, and you want to enroll in this program, you can get all of these awesome benefits. So you've got lots of different fitness centers. You've got classes that are available, like yoga and swimming and strength and cardio training. There's also a home fitness kit that you can get. So if you wanted to do home workouts, then there's free kits they send to you for this. And there's no extra cost. So if you're enrolled in our Kaiser Senior Advantage plan, this is already included as a part of it. You can opt to use it, or you can opt to not use it. It's up to you. But it is a really awesome part of the plan that allows you to, make sure that you're staying in shape, keeping healthy, and, hopefully not having to go to the doctor as much because you're staying healthy. So great plan. It's not necessarily going to be available forever, but the more people that utilize it, the more likely it is to stick around. So just keep that in mind. Next slide, please. Okay, and this is how you register, right? So if you have Kaiser Senior Advantage, or you're going to be signing up for Kaiser Senior Advantage, you can call. You can go on their website, which is listed here, silverandfit.com. You can request for your gym to be added. We have a simple hyperlink there for you to follow at sarah.org/gym. You can search for the different gyms that are available. And just get all the information that you need. It is important to note that this benefit, if you're on Kaiser right now, but you haven't switched to Kaiser Senior Advantage, you won't be able to enroll yet. So you have to get approved for Kaiser Senior Advantage. You have to see the deduction being taken out of your check from Acera in order for you to now get access to this program. So it's not for the non-Medicare plan, it's only for the Medicare portion of this. So if you're eager to get enrolled in this and get going on the Silver and Fit, it is important to note that you have to be enrolled in Kaiser Senior Advantage. Your coverage has to be effective before you'll be able to continue with this and get access to those free gym memberships and all the other good benefits. Okay. Next slide, please. Okay. If you don't want Kaiser Senior Advantage and you'd rather choose a Medicare plan elsewhere, like we were talking about that example earlier, if you're on United Healthcare now and you really like United Healthcare and you want to stick with them, you can go through Via Benefits to select your plan. So when you go through Via Benefits to select a Medicare plan, these are not Acera group plans. So the coverage that you see listed out on our open enrollment guide and on our website, where it talks about the different plan benefits, those are specific to our Acera group plans, right? So these are considered individual plans, and they're not going to be paid for through your Acera check. So if you enroll in a Via Benefits Medicare plan, then you will be paying for it separately. You'll be paying that premium out of pocket and getting reimbursed later. It's a different process. So the way that it works with your Acera check with your group coverage is we deduct the cost, we give you a subsidy if you're eligible for it, and everything's taken care of through your Acera check. Now with the Via Benefits plans, you pay out of pocket for the premium, and then you get reimbursed separately through claim reimbursement. So it's a health reimbursement arrangement, or an HRA, if you've heard of that before. Okay. And if you enroll in these plans, you are responsible for paying those premiums for you and your dependents. And the medical monthly allowance is the amount that's deposited into the health reimbursement account for you to claim those reimbursements for anything related to your plan costs. So this is a really important part of the health reimbursement arrangement. The subsidy that we provide, the medical monthly allowance that you get when you go through Via Benefits to select a plan, only goes towards your part of the plan premium and your medically necessary costs. So if you have a dependent on your plan, like a spouse or a child, and they have a medical premium and they have prescription costs and they have, doctor visits and copays, that's all stuff that you have to pay for out of pocket. You do not get reimbursed for that portion of the plan. It's only your part. So when you sign up for a plan that has, either a +1 plan, like a self +1 plan, or a family plan, it's divided up into different categories. So when that cost of the plan is divided up into your cost as the individual that is receiving Medicare, and then there is the other part of it that is your dependents. And it's really important that you know where that line is, because the only things that you can get reimbursed for are your part of the premium for the plan and your medically necessary costs that can be reimbursed on an individual basis through their claims process. It looks like another question came up. How long does it take for the reimbursement? So that's a really good question. So when you get enrolled with VIA Benefits, the best thing that you can do is sign up for direct deposit for your reimbursements, because then it can just get deposited directly to your bank account. So when you sign up for them, it's an auto reimbursement process, and they will look at the premium that you're paying monthly, and that amount gets reimbursed to you. And they already have a note of it, right? They know what the premium is for the rest of the year. They will be able to reimburse you each time you get charged for that premium. And it takes, anywhere from 5 to 10 business days to get that reimbursement. When you have individual costs, right, that appear outside of the regular premiums, this would be prescription costs or copays, and now you want to get reimbursed, the best way to do it is online. So you can scan copies of your receipts and your medical visits, submit that with the claim reimbursement online to VIA Benefits, and then they will get you your reimbursement. But those ones have to be reviewed individually, and those can take a few weeks sometimes to get your reimbursement credited to you. And sometimes it will get rejected, and they say, actually, you need to provide additional documentation in order for us to be able to reimburse this. But they'll work with you, and they have really good customer service. So that is one of the questions. It looks like the other question is, can this payment for VIA Benefits be set up automatically? Yes, so that is the auto reimbursement that you can set up when you start with VIA Benefits. You'll choose a plan. When you choose that plan, you'll have a designated medical premium that you need to pay each month, and that does get automatically reimbursed to you if you sign up for the automatic reimbursements by signing up for that plan. Again, direct deposit is the way to go, so that it goes directly to your bank account. You don't have to wait for checks in the mail. Okay, another question is, my husband is a retiree with Sarah and is on the Senior Advantage Plan. I will be turning 65 in July and have applied for Social Security and Medicare. Do we both need to complete the group Medicare election form, or I complete it only? So if your husband is retired with Sarah and already on the Senior Advantage Plan and wants to stay with that plan, he doesn't need to sign up or do anything, take any action on his part. Everything will continue normally on his plan. Now, if you are turning 65 and you're a dependent on his plan, or if you're a member as well, also a retiree, then you need to be the one to complete our Kaiser Senior Advantage enrollment form if you want the Kaiser coverage. And that Kaiser Senior Advantage enrollment form should be sent to a Sarah. You can also send it directly to Kaiser. We like for you to send it to us just to make sure that we know what's going on and that we're not dropping your coverage, and we can make sure that the timeline is going on as expected. Okay, and the form that you need to complete is just the Kaiser Senior Advantage enrollment form. There is also another form on our website, which is medical plan enrollment. If you're already on our Kaiser plan, you don't need to also complete that form. It's just the Kaiser Senior Advantage form. Okay. And if you're turning 65 in July, you can go ahead and submit that form to us whenever you're ready, because you're within that 90 days. So. Good questions, everyone. Okay, so VIA Benefits Medicare plan. So let's continue on this. We talked about automatic reimbursement. We talked about signing up for a plan. And again, if you are eligible for a medical monthly allowance, then you get access to that health reimbursement account. If you're not eligible for the medical monthly allowance, it's a little bit simpler, right? Because you just sign up for the plan, you pay out of pocket for it, and that's it. You're not getting reimbursements. If you are eligible for the medical monthly allowance, you will have the health reimbursement arrangement. It's best to set up everything online and then just call them if you have any questions about, getting reimbursements for other items that may come up as a result of having medical insurance, right? Okay, again, only the retiree members can submit the claims. So if you have a dependent that incurs costs, that's out of pocket. There's nothing that Acera will be reimbursing for that. You can't use the health reimbursement arrangement. That is up to you to pay for it. Okay.
One more question, Kip. It says, if I move out of the country, would VIA find medical coverage for out of the country coverage?
Good question. Unfortunately, VIA benefits and also Medicare are only within the United States. So if you move outside of the United States, unfortunately, you are on your own to find coverage in the country that you move to. So if you need coverage, when you move back, it's a qualifying event. You can contact VIA benefits, or you can contact Kaiser Senior Advantage or Acera and start that enrollment process and say, hey, I just moved, 30 days within the last 30 days. Here's my address change. I'm now back in the United States. I need coverage, and we'll get you coverage when you come back. But as soon as you move out of the United States and your address changes, then your coverage through VIA benefits is not an option. Your coverage with Kaiser Senior Advantage is not an option. You will be on your own. Okay, so VIA benefits enrollment. So how do you do it, right? How do you get enrolled in VIA benefits? You can visit our website, which is acera.org/via-med. And when you click on that hyperlink, it'll actually take you out to VIA benefits website. And when you go to VIA benefits website, has this enrollment process. First, they're going to ask for a little bit of information about you, like when's your birthday? Are you enrolling in a Medicare plan? Are you planning on enrolling dependents? That sort of thing. And then you'll create an account with them and then shop for plans that way. They'll be asking, what's your zip code and that kind of stuff. You can also give them a call and submit your information that way. I would definitely recommend going on the website first and giving it a shot. And, if you have any difficulties there, then give them a call. But doing it online is really helpful too, because when you get to the screen where you're shopping for plans, it has all of the information listed out. You can click on different links and tiles to go see different information, and just it's a really helpful comparison tool. Whereas when you're talking to somebody over the phone, you'll still get that information. It'll take a lot longer, and then you can't print anything out that way or download items. So I think just the better informational resource is the website, but both options are totally valid. So if you are going to enroll with VIA benefits, right, this is after you enrolled with Medicare. So if you are doing the Medicare transition, you need to go back and make sure that you enrolled with Medicare first, that you got your Part B, and you're ready to go enroll in a Medicare plan. Now, if you have not already enrolled in Medicare and you try to enroll in a Medicare plan, VIA benefits is going to reject your enrollment. And actually, it's not VIA benefits fault or the carrier's fault that you're trying to sign up for. They're going to say, hey, you can't enroll until you actually go and get your Part A and Part B so that you can enroll in a plan. So it is a really important step. You got to make sure that you do that first, is go through and then make sure you're enrolled in Part B and get that process taken care of with Social Security, with Medicare, and then go to VIA benefits and start your enrollment process if you want to enroll with them. So when you are choosing a plan through VIA benefits, right, you have that choice. Do you want to sign up for Medicare Advantage plan, which likely has Part D built into it? It's all a package deal. You don't have to worry about purchasing a separate prescription drug plan for the most part. Or do you want to go through a Medigap plan, which gives you more options on doctors across the whole country, but you have to purchase a separate prescription drug plan? Both options are totally good. You just have to know which one you might be looking for, and you'll be able to compare the differences between all of those on their website. So again, if you are calling them, then a licensed benefit advisor will be somebody helping you on the phone. So they will be able to give you, some advice. They can't make decisions for you. Obviously, it's ultimately your decision at the end of the day of which plan you want to enroll in, but they are, skilled individuals that will help you understand the differences in the plans that are available to you and help you hopefully choose the best option for you. Okay, and the reimbursements. Okay, so this is an important part too, because reimbursements are based on plan years, right? So if you incur costs, let's say you enroll in a VIA benefits plan effective June 1st, right? So beginning of next month. Now you're paying premiums for that new plan. Maybe you have some doctor visits, or maybe you got a surgery and it incurred an extra expense. You need to submit reimbursements. So you can submit reimbursements within the plan year, within June through the end of this year. You also have an additional 3 months into the next year to submit those reimbursement claims for last year. So again, let's say in July you have a surgery and it comes with a heftier cost, right? But you still have some extra money in your health reimbursement arrangement account, your subsidy from Acera. So if you want to reimburse for that surgery that you had, then you will need to file a claim reimbursement with VIA benefits. You need to have records, receipts from the doctor showing what the procedure was, confirming that it was medically necessary and all of that. And on the form, on the reimbursement claim form, it tells you all the stuff you need, right? It has the instructions on there on what to include on that reimbursement. So when you submit that reimbursement, it's a really important step to make sure you submit it on time. If you wait too long to submit the reimbursement, then you won't be able to get reimbursed for it. And you have a lot of time, right? So you have, if you get the surgery in July, you have until the end of March of the next year to submit the reimbursement for that surgery that you had, or any other medically necessary expenses from the prior year. If you wait, to around this time next year, then any costs that you incurred last year, you're not going to be able to get reimbursed for because you waited too long. Okay, so it's a really good idea is that if you have medical costs, out-of-pocket medical costs for yourself, for medically necessary items, that you go through and do your claims reimbursement process as soon as possible so you don't forget, right? And so make sure you get that taken care of, and then you won't have to worry about the deadline. The deadline is March 31st. It's also not a good idea to wait until the deadline. You can imagine that things get very busy during that time. I think one time we saw their system go down a few years ago, like very briefly on that day, just because they were getting so much traffic on the website. And you really just don't want to wait until the last minute. It's not going to be a happy experience. So it's a good idea if you have medical costs that you need to get reimbursed, that you go ahead and make sure that you get all of that taken care of prior to that deadline. And then the reimbursement amount for the next year will refresh, right? So if you are on VIA benefits plans, you chose a plan through VIA benefits, and now you have your reimbursements for this plan year, all in your health reimbursement arrangement, right? There's a total amount that you're eligible for. That amount is only for this plan year. And then when the next plan year starts, you get a new amount, right? It's the new subsidy amount, but they don't roll over into the next year. So if you don't use some of your reimbursement amount that you had from last year, it's just going to go away. So it's a good idea to file all the claims that you can. If you still have a little bit left at the end of the year, no big deal. It's good that you had your subsidy cover everything. But it's also just something to be mindful of, is that, you don't want to try and save it up over different years, because it doesn't work that way. They will not roll over in the next plan year. It's only the individual plan year has a set amount, and then the next year has a different set amount. Okay. And any amount of the reimbursement that you don't use in your account, like let's say you had $5,000 that was reimbursed, but there was still another 500 that didn't get reimbursed. That money does not go to VIA benefits. It does not go to the carrier. It comes back to Acera and it gets deposited into the pension fund. So anything you don't use, you don't get to keep it. It doesn't roll over, but it does come back to Acera, and it helps make sure that all of our awesome pension benefits and things like subsidies continue to be able to be used going forward. Okay.
Yep, so there's two questions. Just want to address these real quick. So the first question is, I missed the response for out of the country question. Is it not covered while outside the US, but can I file for reimbursement when back to the US? And just to make note that medical insurance, they do have emergency services. So for example, if you happen to be away on vacation, you're on a trip, and you're coming back, you just went on a trip and you happen to get sick or injured, yes, you may, depending upon the insurance that you have, you may need to have the contact the 800 number or whatever number they have on the back of your card, advising them that you're out of the area and that you are on a trip and that you are sick or injured, and they can help coordinate. Or you may have to end up having to pay for that bill, and then when you return, submit the claim forms to your insurance for them to take care of that emergency service that happened. That's usually when it's out of the country. In other countries, it's not as expensive as it is here in the U.S., where it's like thousands and thousands of dollars.
Yeah. Yeah, and it's just important to note too that, you know, your address needs to be within the United States. So if you're traveling, that's one thing. You get emergency services covered for the most part. If you're actually living in a different place, that's where you can run into problems trying to use insurance that you can only have when you're living in the United States. So
the other question, can you see the other question? It's will I be able to see how much money is left for my reimbursement before I submit?
yes. So if you log into your Via Benefits account after you sign up for a plan through them, you will be able to see the remaining balance for your health reimbursement arrangement. And they should also have an area that shows what pending claims you may have. So maybe you have, you know, $1,000 left, but there's $300 in pending claims. So maybe it's more like, you know, $700 is actually left. So that is something that you will have access to. If you submit claim reimbursements over the amount that you are entitled to, Via Benefits will only reimburse up to the amount that you are supposed to get. So if you, let's say, have $250 left for claim reimbursements, but you file a claim for $500, they'll give you as much as they can up until you hit your limit. And then at which point you're out of funds, you won't have any more subsidy for the rest of that plan year. But when the new plan year starts, you'll get you know, your subsidy refreshed and have a new amount for the new year. Yep.
And Via Benefits, they do send reminder notices towards the end of the year, just as a reminder that, hey, you still have this amount left to do in your as a balance. Okay.
Yep. Okay.
One more question, the last question. How can we get the premiums for United Health?
Okay, so if you are becoming Medicare eligible and you're on our United Healthcare plan right now, then you won't be able to stay on that plan like we mentioned earlier, but you can most likely choose a plan through Via Benefits with United Healthcare. And you'll follow the instructions on this slide here. You know, of course, first you have to enroll in Medicare Part A and B, that's through Social Security. Then you're going to go enroll through Via Benefits, and you'll be able to see what plans they have available. When you go through Via Benefits and you are going to select a plan, you should see the United Healthcare options on there. Again, the coverage isn't going to be exactly the same as it was with our group coverage, but there will be United Healthcare plans available, assuming your address hasn't changed, right? Then you can choose from there. Do you want United Healthcare? Do you want to have a different plan? It'll be up to you at that point. But that would be the way to access those Via Benefits plans and get United Healthcare Medicare plans, right?
And the representative advisor from Via, they will show you what you'll be able to see what the premiums are, and they'll be able to provide you the information that you'll be able to make a selection accordingly.
Yep, absolutely. Okay, so that is it for the Via Benefits. If I go to the next slide for the enrollment. Okay, so we've also got the prescription profiler. So this is a special service with Via Benefits. The Via Benefits prescription profiler. So Medicare Part D adds a lot of different prescription drugs to its database yearly, some that may have not been covered previously and now they are. So it does impact the Medicare prescription drug plans due to those changes in the formulary and then possibly the costs associated with creating those drugs. So if you go to the prescription profiler in middle of October, which is a special program, you'll be able to get the prescription coverage information, including a breakdown of the drug costs for the year across a lot of different providers. So if you're thinking about, you know, let's say, for instance, you're on a Medigap plan and you have a supplemental prescription drug plan, this may help you choose a different prescription drug plan that may offer better benefits for you, depending on the prescription drugs that you're taking. So this program allows you to see if there's different plans with lower costs for your prescriptions or just different coverage, right? So that's a nice tool that you can look forward to if you are going with Via Benefits and you need a prescription drug plan. Check it out in middle of October. Next slide, please. Okay, so let's talk about open enrollment. So first, when we think about open enrollment and enrolling in insurance plans, that is specific for making changes to insurance plans. However, when we talk about qualifying events, you becoming Medicare eligible, you turning 65 is a qualifying event, and that is the time that you should be enrolling in a Medicare plan. So, don't be worried if your birthday is in May or in August or something like that, because your Medicare plans will be available to you. You will be able to enroll in them outside of open enrollment. So then the time comes for open enrollment, which is your opportunity to change plans. So let's say your birthday is at the beginning of July, you select a Medicare plan for July, and then open enrollment comes around in November, and you're thinking, well, I like this plan, but I'd like to see what other options there are, and I maybe want to explore something else. So open enrollment gives the opportunity to switch plans. You can change, medical plans, but also our dental and vision. If you want to add dependents or drop dependents or things like that, then you can certainly do all of that during our open enrollment period. So we will send you a booklet sometime around the beginning of October, beginning to middle of October, in a packet. And the packet will have various flyers in it that explain some of the plan benefits that we offer and actions for you to take, or no actions, if any. If you're happy with what you've got, you don't need to take action during open enrollment. It will roll over into the next year. So in that open enrollment guide that we send you in the booklet, it has information about all of our plans that are available. It will have information about non-Medicare items too. So you want to make sure that you're looking at the Medicare items specifically, unless you also have plan dependents that maybe are under 65 or not Medicare eligible, in which case you might need to look at both. Okay. Also in the open enrollment guide, we have contact information for all of our vendors. So if you've been retired for a while now, you've probably already received some of these packets each year. Hopefully you've gotten it each year, which has this information. This is all review for you. Our open enrollment period is in November. So November 1st, November 30th for our group plans. So when you make changes and you enroll onto our group plans or make changes for our group plans, those changes are effective February 1st. So, right, you're making the changes, you're submitting forms to ACERA during November so that they can become effective by February 1st. And there will be new rates for the new year, generally. So when is Via Benefits open enrollment? So again, Via Benefits is somebody we contract with, but they might have different rules than us for things like open enrollment. And actually, they have a longer open enrollment period. So they've got an open enrollment period from October 15th through December 7th for you to go ahead and switch plans through them if you want to explore a different Medicare plan. And those elections are effective January 1st of the following year. So again, for ACERA's group plans, you're choosing a plan that is, you're choosing a plan in November that will be effective February 1st. If you go through Via Benefits, you're choosing a plan sometime between October 15th and December 7th, and that's going to be effective at the beginning of January of the next year. Okay, if you are going to select a plan with ACERA, a group plan with ACERA, your ACERA monthly benefit has to cover the cost of the premium. So some of our plans can get pretty expensive, especially if you're enrolling the whole family, because we only subsidize your portion of the plan, right? So if we're only subsidizing your portion, the remaining costs can get pretty expensive for some of our plans, and your ACERA benefit needs to cover the cost of the premium for those plans. So if your out-of-pocket cost is more than your benefit allowance, then we can't have you enrolled in that plan, or you just can't have as many dependents enrolled in that plan as you may have wanted to. So that's an important note too. Okay, next slide. Okay, the medical monthly allowance towards a SARA-sponsored group medical plan premiums, and HRA individual plans. So we can kind of see, we've been talking about subsidies, we've been talking about MMA, and those terms do get used interchangeably because they are essentially the same thing. The non-Medicare plans, we can see the amount that you would be receiving towards your SARA-sponsored plan. So if you are non-Medicare, meaning you are under 65, then you are going to get a different amount reimbursed for your medical plan premiums. And this may be what you're experiencing now, right? So if you have 20 plus years of service and you're on one of our non-Medicare group plans that we have for medical insurance, the amount of subsidy that you're receiving is $616.12 towards your medical plan premium. So likewise, if you go down the chart here, if you're in that 15 to 19.99 categories or category, then your out-of-pocket or your subsidy that you're receiving is $462.09. So you're still paying a difference, of course, of the premium. 10 to 14 years, 14.99 years, your out-of-pocket is the difference between the plan premium and then this $308.06 subsidy that you're receiving. So what happens when you turn 65? The subsidies that we provide are not the same subsidies that we provide for the non-Medicare plans. And this is because non-Medicare plans are more expensive than Medicare plans across the board. It doesn't mean that every single scenario that's true, but that is, on average, definitely true, is that Medicare plans are less expensive. The other thing is we offer Medicare Part B reimbursements to you when you turn 65 and you're eligible for it, which if you're eligible for these subsidies, you're eligible for that Medicare Part B reimbursement when you turn 65 or when you become Medicare eligible. So you're also getting that subsidy on top of it too. So at first, when you glance at this, you're like, well, I wish I could get as much of a subsidy as I did when I was non-Medicare. Overall, your actual cost for the Medicare plans is likely going to be a lot less. You're going to be paying less out of pocket for medical insurance going forward, and you're getting this subsidy to help cover the cost of the Medicare Part B that you may be responsible for as well. So when you're thinking about switching, it's just important to note, because if you do switch over to our Kaiser Senior Advantage plan, you need to know what subsidy we're going to provide. Another really important note here is we've been looking at that amount for the Kaiser Senior Advantage plan, right? It's $316.81. So when we're looking at this, chart here, this is specifically through Via Benefits. So if you choose our Kaiser Senior Advantage plan, the actual subsidy that we'll provide to you, the amount that you'll see on your pay statement, is only going to go up to that plan premium. So the plan premium for Kaiser Senior Advantage is $316.81. We will not be giving you a subsidy beyond that $316.81 for the medical plan. You'll still get the Medicare Part B reimbursement, assuming you applied for it and you're eligible for it. But the actual amount that you're seeing here is not like an excess. So we don't go over that amount to reimburse you for the Kaiser Senior Advantage. It's just the plan premium. Okay. But if you go through Via Benefits and you select a plan, you actually get access to more money here. So if you have 20 plus years of SARA service credit, $471.99 per month, right? So that's over $5,000 a year in medical reimbursement, almost $6,000 a year in medical reimbursement that can go towards plan premiums, prescriptions, copays, for anything for you as the SARA member. And then the categories go down based on the subsidies that you may receive based on your years of service credit, right? Okay, next slide, please. All right, so qualifying events. So again, becoming Medicare eligible, right? That is a qualifying event. You get to enroll in a Medicare plan when you become Medicare eligible. That's a 7-month period, but we want you to get that process going within 90 days prior to your 65th birthday. If you lose your coverage elsewhere, so like let's say for instance, we were talking about the time where you are on a spouse's plan. So let's say your spouse is still working and you're getting really good coverage through your spouse. Maybe you deferred Medicare coverage because you're still on that spouse's employer plan. But now your spouse retires or they lose their job or something like that. Now you've lost your coverage. Well, what can you do? It's a qualifying event. You have 30 days to enroll. So you can now enroll in a Medicare plan. You can enroll in Part B and get going to enroll in a different plan. That is an example of loss of coverage. So what if you relocate out of the service area, right? Our Kaiser plan is only for Northern and Southern California, and not all of Northern and Southern California. It's only within some areas. So let's say you move to a different state, or you move outside of the coverage area for Kaiser, then you have a 30-day window to enroll into another plan. You'd contact Via Benefits and say, hey, I just lost my coverage. I need a new plan. And they would help you get enrolled in that new plan. Okay. Same thing if you're on a Via Benefits plan, like a Medicare Advantage plan. Let's say you're already living in Oregon, for example. Kaiser is not in Oregon. Our Kaiser plan is not. So if you're in Oregon and you have another plan and now you're moving, to Idaho or something, well, you probably need to select another plan now. And you have 30 days from the time that you move and change your address. Really important that you change your address with Acera anytime you move, because that is kind of what drives this ability for you to switch plans, and allows you to have that 30-day window, the qualifying event, to enroll into a different plan. So again, it's a really good idea before you move to check what coverage is available before you move, because you don't want to just pick this, beautiful plot of land somewhere, but there's no doctors around, and now you're feeling kind of left out because you didn't choose, you didn't research it ahead of time. So it's good to be proactive and make sure that you know what coverage is out there. Ish, did you want to add something?
Yeah, so Kaiser, there are Kaisers in other states outside of California, but however, our contract is on with the California Kaiser. So if you do relocate out of state and you're in Kaiser and you relocate to an area where that does have Kaiser service outside of state in another state, then you would be needing to contact that Kaiser to enroll into an individual plan with that Kaiser. They'll be able to confirm that you are now residing in their service area. You would then transition off of our Kaiser and onto that individual Kaiser. So you will not be seeing the Kaiser deduction or the subsidy on your Acera monthly benefit anymore. But because you're now enrolled into an individual Kaiser in another state, you would, once you're enrolled, you would then contact Via Benefits to activate the HRA and opt in so that you can continue getting your reimbursements. Okay.
Yep. Okay. And then, actually, can we go back to that slide? Sorry. Perfect. Okay. This says retiring after age 65, but actually retiring anytime with Acera specifically, you are eligible to enroll in a plan. So that is a qualifying event by itself. When you do retire, you are able to select a plan, and it's a qualifying event through our group plans, and then also through V benefits too. Or if you get married, right? So if you are married now and you have a new spouse, you have a 30-day window to enroll that spouse on your plan. Alternatively, you can wait until open enrollment, right? So you don't have to add them right now if you're not sure that you're ready to do that. Or if they have other good coverage, but eventually you want to add them on, you can always add them later during open enrollment. But the 30-day window for a qualifying event is important. So if you get married, or you're thinking about getting married, then you need to know when that 30-day window is from your marriage date, so that we can make sure that we take that action that we're supposed to. Same thing with a new domestic partnership. It works the same way. So 30 days from the day that you're registered as domestic partners, you can enroll in a Medicare plan. You can enroll through Via Benefits. This is, you're adding them onto a plan, right? Your spouse or your dependent is now being added onto that plan. Same thing for divorce. So if you separate from your spouse or your domestic partner, then you have the ability to have that individual enroll onto a plan. So for instance, you as the individual, if you're already receiving coverage through us, just because you're getting divorced doesn't mean you get to change your plan, but your ex-spouse now has an opportunity to enroll in a plan. Likewise, if you're enrolled as a dependent on your ex-spouse's plan, you get divorced, and now you have 30 days to enroll in our plan. either through Via Benefits or through Kaiser Senior Advantage. So we do have a page on our website about qualifying events that kind of goes over this in a little bit more detail. But just keep in mind, one really important thing is the address, right? That's usually where people fall short. You move and you don't think about your coverage until it's too late. It's really important to make sure that anytime that you are thinking about moving, you research ahead of time and figure out what coverage is available in that area. And then when you actually do move, you notify ACERA of your address change, right? It's on our website. If you go to acera.org/forms, that's where all of our forms are. You'll see the address change form there. You can also log into your account and submit the form, but just make sure that you think about that. Keep that in the back of your mind. Anytime you move, you have to let us know what your address is so that we can get your coverage all situated. And you only have 30 days to do it. So it's really important to get that time window figured out. Next slide, please. Okay, so this is kind of what we're talking about, but just to review it, make sure you make sure you look into available health plans prior to moving. You have to make sure that you know what your zip code is. It's okay to know kind of like the general area, but if it has to be the zip code, right? So you don't know exactly what the exact address is, but that's fine. The zip code is really what drives the insurance coverage, right? If you have questions on this, you can always reach out to us and we'll talk to you about what to do. But mainly, if you're moving out of a service area, what you should be doing is calling Via Benefits to help them, to have them help you figure out what your next coverage is going to be. You got to get that address change form submitted to us so that we know that you're moving. They basically won't let you sign up for another plan until you've updated your address with us. They'll say, well, you don't live in that new area yet, so we can't, enroll you in the plan. And until you update your address with us, you may keep getting that same answer, right? If you are living outside of California, you may not have to pay California state taxes if you no longer have residence in California, but it's always a good idea to talk to a tax advisor before you change your withholding and get that part figured out. Okay, and this is where you go to our website to find that address name change form. You can also call us, we can send it to you. Even if you need us to send it to the new address, we can call, verify you over the phone when you call and make sure that you're the right person, and then we'll send you a blank form for you to fill out and send back to us. But it's best to do that before you move. Get your address changed with us before you actually move and give us an effective date, and then we know what to do as soon as you've moved, okay? Next slide, please. All right, so we're going to wrap up here. If you have additional questions, and I think we've answered everything so far, but if you have additional questions, you can always send us an email, info@acera.org. We should be responding to you within 1 to 2 business days. If you have questions too, you can also call us between 9 and 4:30 Monday through Friday, and we're always happy to help you, get the process started. Via Benefits will help you with the enrollment with Via Benefits. They're separate from us, right? We contract with them, but they are not part of ACERA. So if you call them to get help, we don't work with them like 100% closely, but if you ever have any issues with Via Benefits, definitely reach out to us, and we will be able to work with them and make sure that you get the help that you need. Same thing with Kaiser. If you're going through a Kaiser enrollment, or if you have questions for Kaiser, they have a separate phone number too, for you to call and get help with them. And if you run into any issues with that at all, give us a call too, and we're always happy to help answer any questions you might have. But Medicare's website is also an awesome resource. Again, I would recommend checking it out. Ish had mentioned the Medicare handbook. Is Medicare and You is the title of that, and that's a really good resource too, to make sure that you go ahead and get everything that you need figured out, and just keep yourself informed, right? We will have our video posted here on the website. Should take a few business days, up to a week possibly, the recording of this webinar. And I see a question just came in, where to call us. So our phone number is 510-628-3000. And that is available on our website as well. If you go to www.acera.org, there's a contact us page. It has our hours. If you wanted to come visit us in person, you certainly can. We'd encourage you to call and make an appointment if you do that. And just one more time, the phone number is 510-628-3000. 3000. Okay. All right. Does anyone have any last questions? I think we'll hang around for a few minutes just to make sure that any questions get answered that may not have gotten answered. If you have a very individual question that you're not comfortable asking in front of the group, definitely just give us a call. We're always happy to help you out with that, or send us an email. Okay, do you have VIA Benefits phone number? We certainly do. If you could help me go back to that slide, we do have it on the VIA Benefits enrollment slide. We can go back there and capture that. There we go. Yep. Okay, there's the link for the website. And then also there's the phone number if you want to go ahead and write it down or take a screenshot or something. Okay, and we'll just give it, how about one more minute? Just to make sure we've answered everyone's questions. Okay, it looks like people are dropping off now. So just wanted to say thank you, everyone. Appreciate your attendance and best of luck enrolling in Medicare and finding a really good plan that works for you. We're always here to help. So if you have any questions, definitely give us a call, send us an email, go on our website. We'll help make sure that you get through this process and get enrolled exactly as you plan to. So thanks, everybody. Have a wonderful day.